Hi, everybody. I am Sherry Morrison, and I am the founder and co-owner of Success by Design Wellness. And today I'm going to be talking to you about a topic that normally doesn't come up in regular conversation, but it's about incontinence and sexual dysfunction. So first of all, I just want to just back up and just tell you a little bit about our practice. My business partner is Dr. Tammy Horner. She's an anti-aging functional medicine physician. We actually focus a lot on wellness overall, anti-aging, medical weight loss, aesthetics. We also help with urinary dysfunction and sexual dysfunction. And we have a very nice aesthetic program with medical devices that are FDA approved that tighten your skin and get rid of unwanted fat and build up muscle, and even help with like scars. So we also do the Botox and the fillers and the Sculptra. So we're just basically a one-stop shop. So today we're going to be specifically talking about a medical device that we have brought in over a year and a half ago, and it really truly has been a game changer. It is called Emsella. So we are actually going to be doing a raffle. So as you're watching this webinar, I would appreciate it if you would comment just your name or like core to floor or something, so I know that you're watching the webinar and you will be enrolled in a contest where we're actually going to be giving away a package of Emsella. So you do have the opportunity to win this. As I just, let's just talk about, to get started, just some facts about life. So we're all dealing with this no matter what age group that we're in. And what I'm really targeting the patients to talk to right now are mommies and women that are going through menopause and men that have been dealing with like prostate cancer or chronic illness. All of these things can lead to a pelvic floor weakening. And I know like pelvic floor therapy is all the rage right now, but there is a device out there called Emsella that really will help you achieve the results that you're looking for and reduce the symptoms of urinary incontinence. And I'm talking about like waking up in the middle of the night frequently to go to the bathroom, frequency, urgency, like when you sneeze or you cough or you exercise, you pee a little, or you always have to wear a pad. You can't even watch a movie or go to the mall or shop without having to find every bathroom. I mean, these are the stories that we hear, and I do have some real patient testimonials in a few minutes that I'll let you watch. But the bottom line is that we are all losing muscle mass after the age of 30, about 3 to 5% of muscle per year. And women that have children, either vaginally or C-section, can experience something called diastasis recti, which is basically a separation of your abdomen. And that actually can be aesthetically seen. And it's really, really hard to like flatten your abdomen back out after having children. I'm talking to people that have like chronic back pain that are not able to exercise or work out their core, and people that are getting like a lot of back injuries just from not being stable. So these are the people that we're talking about. 23% of women actually have to not work because of problems with their incontinence. And it's something that you just don't talk about with your friends. And women are paying a lot of money to deal with this, at least about $900 a year for just routine care for incontinence. And not only is it affecting like your quality of life, but it's also affecting your sexual relationships with your partners. 25 to 50% of women with urinary incontinence experience some sort of sexual dysfunction. And a lot of women go undiagnosed. Like 54% of women actually are not diagnosed with the incontinence because they're not talking about it. But 45% of women are losing intimacy with their partner, and they can't even work out because their fear of having incontinence episodes. So now's the time to take control of this, because there is a non-surgical solution, and that is called Emsella. In fact, the patients that have been studied with Emsella have proven a 95% improvement in quality of life. So let's just watch a video on how Emsella works, and I'll get more into detail with that in a moment.
All right, everyone, so I wanted to show you, I am sitting on the Emsella right now. This is my third treatment. I'm going to begin it after this video. But when you come into Design by Success, you're going to put on these shorts. So there's better contact, and you want to get into a good position. So I'm going to show you. This is kind of how you sit. And the machine has different levels, so I like to turn it all the way up. I find it to be pain-free, but you'll find a level that works for you, and they'll guide you through it here. But really, I've already noticed results in just 2 treatments. Again, I'm going to start my 3rd here in just a little bit. But I've noticed I'm not waking up as many times during the night, because I mentioned before, I used to wake up 5 to 6 times during the night, because I always felt like I had to go to the bathroom. And I've also noticed when I have to go, it's not like such an urge where I like have to run to the bathroom. So again, this is after having 2 back-to-back babies. Mine are 14 months apart. So I wanted to find a solution so I didn't always have that pressure on my bladder, and I felt that I wasn't running to the bathroom. So if you're a mom, you know what I'm talking about. And even if you're not a mom, you may feel like you have to go to the bathroom all the time. So this works for so many, including men as well. So I can't wait to share how I feel after my 6th treatment.
So this is a very popular device. It's been on the Housewives reality show. It's been on the doctors. In fact, I have a little clip that I want you to watch on the doctors in a moment. Goop, Sex with Emily. It's been in all the beauty magazines and health magazines, even in the New York Post. So here's a little clip of Emsella on the doctors.
It affects millions of people, all by sitting in a chair. This chair is reportedly treating urinary incontinence. Urogynecologist Dr. Red Allenside joins us to explain with his guests, Kitty and Nancy, exactly what's going on. So, Dr. Allenside, number 1, does this really work, and how the heck is it working?
Well, this is a revolutionary procedure that really does work and help patients. It's an FDA-approved device that uses electromagnetic waves and focuses it onto the woman's pelvis and gives over 12,000 contractions in about 28 minutes.
So, Doc, you're talking about 12,000 Kegels?
12,000 Kegel exercise contractions, but much harder than you can physically do on your own.
And how long would that take, ladies?
Yes.
Right? Yeah.
I think that's a lifetime of Kegels,
Right.
I think.
It is, but I'm just wondering, ladies, how does this feel? Because I imagine it must be pretty intense to sit there and have that many Kegels.
It feels really good. It feels almost like an orgasm. It's,
Whoa! Girl, you are winning.
These seats are going to sell like hotcakes.
Wait, is this only for incontinence? Not only.
I think it's time to buy stock in those chairs.
Yeah, I know, right?
Should.
Women are going to come to you and like, I don't have incontinence, but I heard you have this chair that does something else too as a side effect. I would like to sit on the chair, please.
But Dr. Allenside, this is a very serious issue. So that being said, I mean, a lot of women suffer from this. Explain to us how it helps.
Well, what this does is it focuses that energy. The magnets down below are quite powerful, and it makes the muscles contract quite hard. It's like a workout for your pelvis, and it actually causes the muscles to hypertrophy or get bigger. It also helps the nerves become less overreactive, so that the patient who feels that they have to pee all the time or waking up at night frequently and can't get good sleep, those nerves seem to be calmed down. Also, it strengthens the muscles strong enough so that you can contract and control that accident, that urine that keeps leaking out when you cough, you sneeze, you jump. It strengthens and helps the nerves, both at the same time.
All right, so Nancy, you've actually completed your 6 sessions. That happened several months ago. So today you're getting a little bit of a maintenance session, correct?
Yes, today I am. I feel so much better. I have way more accidents. My confidence has boosted up. This worked for me.
And Kitty, you gave us a little bit of an idea how this feels for you, but that being said, I mean, is this something that you would want to continue? And
yes, most definitely. My incontinence.
Sean, yes. Is that a real question? Is that a real question? Yeah.
so Nita, so many women.
It's so many women. So urinary incontinence impacts 200 million people worldwide. So really, really common. Even some people in the audience are saying, yes, me too. And when we look at incontinence, you know, there are a number of different causes. pregnancy, childbirth, menopause, obesity. We know that as people age, the prevalence and also the severity of incontinence will increase. And typically, we will tell people to do things like those Kegel exercises at home. We'll offer them pelvic physical therapy or maybe nerve stimulation. In some instances, some types of medications are appropriate depending upon the type of incontinence they have, or they'll go to surgery. Now, I do want to ask, there are different types of incontinence. Sometimes people will have incontinence when they cough, laugh, sneeze. That's stress urinary incontinence. In some instances, people say, well, I was fine, and then all of a sudden I had to go. And so when you got to go, you got to go. That's urgent incontinence. Sometimes you have a combination of them, and then there are other types. So I want to ask, what does this procedure treat? Any specific type of incontinence, or like who's an ideal candidate?
I have the combination.
I did too.
And
I did. Yeah.
the FDA has approved it for urinary incontinence that can be both the stress incontinence type, the one where you leak when you cough, sneeze, and jump, and it's also FDA approved for the kind where you get the urge, the frequency, feeling like you have to pee all the time, every hour, every half hour.
Yeah.
You can't finish a movie. You can't go on a long airplane flight. So it's approved for that, for both types of incontinence. And it also does help those people who don't have that sensation to pee and their bladder gets overfull. That's called overflow incontinence, and it helps those type of patients too. So this we affectionately call the pee-pee chair, because it will help those with pee-pee problems.
So, Dr. Allen, I'm just curious, is this procedure covered by insurance?
Unfortunately, not at this time. It's not covered by the insurance. The average payment per session is between $200 and $300 approximately, and it's affordable enough for the patient to have a 3-week treatment. You need one treatment twice a week, so that's 2 times a week for 3 weeks, and touch-ups every 3 or 4 months. If you get pelvic floor physical therapy, that's usually about a 12-week course. So this cuts it down dramatically to a 3-week session, and it helps the patient in a shorter amount of time.
And I do love that you said it's FDA approved. I also really like that you're hitting 3 big categories when it comes to types of incontinence. I would really be excited to see larger studies where we're looking at even more women and looking at those long-term benefits. So I think this is really exciting. It's a great option, and hopefully we can continue to evolve and kind of nurture the whole process, and maybe we'll come up with something that's long-term that's just as convenient.
Many studies are currently out there examining the long-term effects of this device. This device is not new. This technology has been around for over a decade, except now we have stronger magnets, we have smarter software, and I believe this is going to stay in the field of OBGYN and urology.
But I do want to say one thing, and I don't know if maybe you have a pen. I want you to write this down. Make sure you tell the researchers not to get rid of that orgasmic side effect. That's very important.
Yeah,
Write that down.
yeah, and for our viewers at home, I would emphasize that since this relies on magnets, please make sure to tell your doctor if you have any metal implants as well, because that could be very dangerous.
And Dr. Allen said technology is crazy interesting, and guests Kitty and Nancy, thanks for coming, and best of luck to you. Stay tuned. You don't want to miss what's coming up next.
Coming up.
So, I mean, I really felt that that was a really great explanation of how the device works. We have another story, because this is not only for young people that have had children, but it's also for women in their 40s and 50s that have been dealing with diseases of aging and some of the complications that go along with that. So here's Lauren's story. I'm sorry, we need Patty's story.
Hi, I'm Patty. I'm a patient here at Success by Design. I was asked to speak about my experience in the Emsella chair. I had stage 4 colorectal cancer and had some pretty traumatic surgery and lost a lot of feeling and actual bladder control after my surgery, and was really stagnant in my healing, and discovered the chair, and it has made a world of difference for me. I definitely have more bladder control. It's enhanced my sex life and really increased my quality of life. Thank you.
And Patty's story is stories that we're hearing all the time from our patients that have completed their Emsella treatments. So I just wanted to give you just, an idea of where your pelvic floor is located. It's right here in both men and women, holding up your bladder, your rectum, and the bladder, when that's laying on the pelvic floor and that pelvic floor is weak, that's where you're seeing the incontinence. In women, we also have, of course, our uterus is supported that way. So, when you have a weak pelvic floor, you can get like a uterine prolapse. And it even can affect if if your pelvic floor is weak, it is even like supporting your spine. So you can even get like lower back pain from having a weak pelvic floor. So what Emsella is doing is that it is sending this magnetic energy called high fem directly into the pelvic floor and contracting those pelvic floor muscles and vaginal muscles 12,000 times in a matter of a 28-minute treatment. And like you just saw in the video, you were coming in twice a week for just 3 weeks. And that is enough to lift and strengthen and cause that pelvic floor muscles to get more dense and be able to support all the organs that are actually depending on it and lift everything up so that you're not experiencing these different types of incontinence. So when you have a strong pelvic floor, you really aren't dealing with any incontinence. Your vagina is tighter, so you're enjoying sex a lot more. And even for people with like chronic constipation, strengthening that pelvic floor can also help with that. So, and this is the same for men too. Men, a lot of men go through prostate, enlarged prostates or prostate cancer, have the surgery, and then they're dealing with incontinence too, or getting up in the middle of the night frequently. So Emsella is also working right on that same pelvic floor that's holding up their bladder. And it also helps with like erectile dysfunction and sexual enjoyment in both men and women, because the energy is increasing that blood flow and it's contracting your vaginal muscles, so you're a lot more sensitive. And for men, of course, it helps with the erectile dysfunction. In fact, like the satisfaction rate or improvement in quality of life is 95%. You're not going to have to wear the pads anymore. You're going to be able to start exercising again. You're not going to have any surgery. There's no downtime with this. You come in, you come out. And after usually the 3rd or 4th treatment, most people actually feel relief. And you can feel relief in like as little as 3 weeks. So this is just an MRI study. There's many, many, many MRI studies of the pelvic floor muscles and how they are thickening and getting stronger and thicker, as you can see in this MRI. So everything like your bladder is being lifted a lot higher. So one more testimonial for mommies. If you could just play that video for me.
I had a baby. And after you have a baby, obviously there's different changes with your body, and it was something that I wanted to try out and see if it would help, whether it was to tightening everything up and also helping with my bladder, because I know maybe not after your first kid, but your second kid, sometimes going to the restroom can be an issue with your bladder after having a kid or two. So I thought I'd kind of get ahead of the game and do it after my first one. I was seeking out things for the incontinence, but I never knew that there was anything like this as an option. I was actually just trying Kegels and, looking up different vitamins, even though I know that was probably something that wouldn't work, but just Googling incontinence and what could help it. And when I mentioned it to my girlfriend, she had mentioned Emsella, and it was a game changer for me, so I made an appointment right away. The sensation physically, if I'm going to be honest with you, felt kind of like you were sitting on a vibrator that was not getting the job done. So that's what I would probably say, honestly, that it really felt like. I was able to go back to normal activities completely fine. I actually went to a spin class right after a few of my treatments. So I went back to working out, went back to having sex with my husband, all the normal activities. I would absolutely have Emsella performed again so that I can continue not having incontinence and my husband being a happy camper.
So The next topic I want to talk to you about is just overall your core. Now, many people don't realize that your pelvic floor muscles are part of your core muscles, but you also have your glute muscles and your abdominal muscles. So at Success by Design Wellness, we have another device that we have brought in that complements Emsella, and that's called Emsculpt Neo. Emsculpt Neo uses the same type of high fem energy, the magnetic energy that you have learned about, but instead of stimulating the pelvic floor muscles, the energy is going over your large muscle groups or small muscle groups. It can actually be used on your arms, your legs, your abdomen, your glutes to lift and get stronger. And like Emsella, it does contract those muscles, but with Emsculpt Neo, it contracts your muscles 20,000 times. And so, as you can imagine, you're going to get a lot stronger in your core. And if you do Emsculpt Neo on your glutes, that will also help make you stronger and help lift the glutes. But there is something that a lot of women that have had babies actually experience and struggle with, and there has never been another solution other than doing a tummy tuck, and that's called diastasis recti. This is just a picture of it, but it's basically abdominal wall separation. And that actually can physically be seen aesthetically, like when you're looking at yourself in the mirror. And if you do have like some stubborn fat left over from being pregnant, sometimes it's not as obvious, but there is a way to assess for that. And just so you know, anything that you're interested in learning about, we offer complimentary consultations. And I would just absolutely love for you to come in and do a consultation with me, and we can go ahead and decide like what the best treatment protocol would be for you and what we're trying to target. And everything is very individualized. But with this core to floor therapy, that's something that we introduced, and we're using both the devices, Emsella and Emsculpt Neo, to basically target those core muscle groups, your abdominal muscles and your pelvic floor muscles, to help increase the muscle mass and give that strength and tone and control. And that's going to help with your balance. It's going to help with your strength. And it's going to help get rid of like any type of visceral fat that you might have hanging around. And it's just one of the best non-surgical solutions to strengthening your core. So the benefits are, the core to floor is improved core strength, obviously decreasing in all the symptoms of urinary incontinence, stubborn fat reduction. It helps with erectile function, sexual satisfaction, improving your muscle mass, and overall helping prevent injuries by giving you better balance and improving your posture. And when you do a treatment of Emsculpt Neo, it is a super maximal contraction. So you are getting results more than you ever could than going to the gym every single day. In fact, they actually equate one treatment of Emsculpt Neo to a month in the gym. So that's something to consider if you have been struggling. And just like all the other studies, there are MRI studies for Emsculpt that show that it is closing the abdominal separation, that the muscles are duplicating and getting stronger, and the pelvic floor muscles are thickening and lifting your bladder. And all of that has been proven over and over and over again on MRI trials, and we're seeing those type of results in our practice. So aesthetically, these are just some before and after pictures of patients that have done the core to floor therapy. You can see overall just like an elimination of that stubborn subcutaneous fat and more tone in the abdomen. This is somebody that definitely had the diastasis recti, and you can see the separation is much less prevalent and the abdomen is much flatter. And same thing with this picture. So this is the perfect mommy makeover, no matter what age you are or whether or not you had a baby or not. It really doesn't matter, because everybody needs a stronger core. And if you are struggling with pelvic floor disorder and you are considering going to like physical therapy for that. This is so much of a, it's just a much quicker, more effective solution. And, you know, nobody wants to be struggling with this for any longer than they actually have to. So for today, we are taking off 50% off of all of our Emsella packages and Cortiflor packages. All you need to do is just comment below, or if you want, you can call our office and make an appointment for that free consultation. The phone number is 727-548-0001. Or if you just want to find our website and contact us through that, that would be awesome as well. But don't forget to comment below, because we do want to do this giveaway for a package of free Emsella. Thank you so much, and I hope you guys have a wonderful day.